Assalamu alaikum and a very good evening, ladies and gentlemen. I hope you're all having a wonderful evening and very excited for today's webcast as I am for today's session. My name is Rania Rajput. Those of you who do not know me, my name is Rania Rajput. I'm the Chief Secretary for Youth, Mental Health and Social Health at Pakistan Health Parliament, and I'll be your host for today's session. Well, today, I would definitely welcome you all for today's session where we shine a spotlight on crucial yet very often overlooked aspect of healthcare. That would be emotional intelligence. As we navigate the intricate landscape of Pakistan's healthcare system, it becomes increasingly evident that the ability to understand and manage emotions effectively holds profound significance, right? So join us today as we explore the vital role of emotional intelligence and enhancing patient care, fostering empathetic relationships, and ultimately transforming the healthcare experiences in Pakistan. But yes, even before that, I would really think that it's significantly important to be sensitized on some of the most prevalent misconceptions regarding emotional intelligence. You know, living in a collectivistic culture in Pakistan, we do have certain misconceptions about it, and that will be emotional intelligence is all about being emotional, which people believe that emotional intelligence is something you're born with and cannot be developed, which, by the way, research has proven otherwise, that it has shown that EQ can be learned, improved through self-awareness, intentionality, and practice. The other would be emotional intelligence means always being positive. Emotional intelligence is solely for personal relationships. Highly emotional intelligence means being overly agreeable, and emotional intelligence is a feminine trait, and so much more. So there have been quite a few researches that actually envelop what we would be talking about today. That will be the nexus and the significance of the same. One of the researchers here in Pakistan have suggested that medical educators in Pakistan should look for ways to incorporate building blocks of emotional intelligence in our curriculum. That would be emotional intelligence instrument can be used as an adjunct to admission process to measure desirable personal attributes in future physicians, which can be further nurtured during medical trainings. But before starting a conversation, I would really welcome Mr. Pervaiz Bashir. He does not need or require any sort of introduction. He's a co-founder and director of Data Brain Solutions. He's the CEO, Thin Line Consulting's Private Limited. He's an advisor STPV to President CPSP. He's a vice president Tehjan, chief facilitator CPSP Department of Medical Education. He's a corporate trainer and life coach, and so much more. So I would really, the stage is all yours, sir. Please introduce yourself again to our audience, and maybe we can have a conversation then.
Thank you, Rania. Thank you very much for much detailed introduction. And I really appreciate the Pakistan Health Parliament for inviting me today to talk about this, one of the very important aspect of emotional intelligence. You have talked much about it, and I'm sure that in next about for 30 minutes or 40 minutes, we'll be talking a lot about this subject. Well, to begin with a little introduction about myself, I started my journey in the medical profession way back in 2000 when I joined College of Physician Surgeon Pakistan as the medical educationist and director of medical education. And we started working on different aspects of medical education development programs. We started conducting communication skill workshops. Way back in 1979, basically the WHO introduced certain workshops in Pakistan. And one of the workshops in Pakistan that was introduced to College of Physician Surgeon was communication skills. So I started conducting those workshops way back in 2000, and till 2019, I conducted numerous workshops all over Pakistan and even outside Pakistan on communication skills. So that is my journey with interacting with the medical profession. And during this process, this period, I also got into inventing few very important things of residency program systems and the structured medical education systems. So we invented many things during this course of time. So today I'll be talking about the emotional intelligence. And as you just mentioned, that this is basically one of the very important aspects of a healthcare professional, because we know that Pakistan has got a very like a tough situation in healthcare services. Like we got a very limited budget and low access to the health facilities, and then we got a lot many challenges that we see that the medical professionals are actually facing. These challenges are actually problematic for them to provide the best services. So we'll be talking about these topics, that how the emotional intelligence, which can help healthcare professional and the patient to strengthen the doctor-patient relationship. So with this, we will be talking, and I'll be welcoming any questions that you have. Please, we start with the questions, and we'll move on.
Sure, sir. That was a really, really detailed introduction, and of course, you don't need someone to introduce yourself. Your name and your vision is itself an introduction of your own. But yes, of course, I do really think that it should not be an interview kind of question answer session. It would be a conversation that we would be having with our healthcare professionals and any of our audience members. As you've actually talked about your experience in healthcare sector, right? So I would really want to know what are the most common emotional intelligence challenges faced by doctors and healthcare workers in Pakistan, as per what you have actually comprehended.
There are a number of challenges. One of the biggest challenge is you can say, the crowded healthcare setups. The number of patients that the doctor are seeing every day, the kind of emergencies, they are crowded with the people with the emergency, and then OPDs are so filled with the people. So one of the biggest challenge of a healthcare professional is the number of patients that they see in a given time. So because of the crowd and the number of patients, they have a problem of not being able to interact the way a healthcare professional should be interacting with the patient. Like you just imagine that if a doctor has to see, say, about 40 to 50 patients in about 3-4 hours OPD, or maybe 5 hours OPD, is you see 50, 60 patients. So you can well imagine that what kind of emotional trauma and stress that he or she would be during that process. And then the kind of the pressure and the demand. And every patient, the doctor who's seeing a patient is not actually seeing one patient at one time. He is encountering one patient and maybe 2 or 3 attendants at the same time. And the attendants are also demanding so many things. So one of the biggest problem is the workload on a doctor. That's number one thing. Secondly, in our healthcare setup, there's hardly any education on emotional intelligence, on how to control of self emotions, and how to like manage the patient, and how to communicate effectively. For example, if we say that they need to empathize the patient, they don't have time to empathize the patient, and at times they feel that it is if they start interacting more with the patient, they will not be able to settle the load of the patient that they have at that moment. So there are a number of challenges. Another very important challenge that the healthcare people are actually suffering is the overall stress, because in our country, the pay structure is not very healthy. The environment and where they are actually working and sitting are not very hygienically good and controlled buildings, or you can say OPDs or whatever it is. So people are having a lot of mental and physical and even financial stress on them. So because of these stresses, they have a problem of not being able to give maybe they do their best to provide the best services, but still because of these stresses and because of the limitations, because of these situations, people are having emotional leakage. When I say leakage, means sometimes they burn out and they get exhausted because of the long calls and the long sitting, and because of that burnout, they tend to express their feeling sometimes, which is not needed, which needs to be controlled by a doctor. So these are the some challenges that we see, and another very important thing that they have to see is our society has got a lot many myths and taboos. So patients are actually having another problem that they come to a doctor on a time when actually जब आप इस तरह समझे कि जैसे डिजीज के लिए अब कोई खास ज्यादा काम नहीं हो सकता ज्यादा अब जितनी भी मेहनत करें उस पर सिर्फ मरीज को आप थोड़ा सा व्हाट यू कैन डू इसके उसकी केयर की जा सकती है लेकिन उसको शायद ठीक नहीं किया जा सकता तो हमारे माशरे में एक बहुत बड़ा प्रॉब्लम जो है वो ये कि पीपल कम टू द डॉक्टर व्हेन जब डिजीज जो है वो सर के ऊपर चढ़ गई है और अब वो उससे ठीक होने के चांसेस बहुत कम है तो हमारे इस तरह then another very important problem is the people have got our population got a low IQ and because of the low IQ they believe that they go to quack or they go to any other facility wherever they think is affordable and they come to the doctor at a very last moment and when they come to the doctor they just believe that it is the doctor who is to take the decision. And because of these situations, I believe that we have our healthcare setup has got a lot many challenges, a lot many challenges.
That's actually very true, sir. Thank you so much for sharing your thoughts. It's quite clear that addressing these EQ challenges is very crucial in for enhancing patient care in Pakistan. जिसने आपने कहा कि हमारे cultural factors इतने ज़्यादा हैं पाकिस्तान के that influence the way healthcare professionals actually interact with patients, and a very fascinating perspective of yours. Understanding the impact of cultural factors on healthcare is much essential for fostering cultural sensitive care that we would actually want to employ in Pakistan.